we are now joined by Dr. Gary Voccio, our district public health director. Good morning, Gary.
Good morning, Doug, and good morning to the beautiful city of Rome. What a beautiful morning we had.
It is a nice morning. It starts to feel like fall, and boy, any more when we start thinking about fall, we start thinking about flu vaccines and COVID vaccines now.
And other vaccines. Thank you for the time to talk about this. Yes, we're approaching flu season and COVID season, of course. And we also have to talk about other, I would like to discuss briefly the other viruses, but COVID in particular. The CDC approved the Advisory Committee of Immunization Practices recommendations to approve the current COVID vaccine. So we have COVID vaccines available, limited quantities right now in our health departments, and some of the local pharmacies, I'm sure, have COVID vaccines, and maybe your healthcare provider, but if you are interested in getting COVID vaccines. And COVID vaccines are recommended with, discussion with your healthcare provider for anyone over 6 months of age. And we recommend particularly the very young and the very old consider getting their COVID vaccines, along with flu vaccines, and if you're an eligible adult, an RSV vaccine. All of these are typically seasonal for the most part, particularly COVID and flu, of course. RSV is a little different, but still it more or less a seasonal respiratory virus. And I have to tell you, I was not aware of this until I started, I read this information daily, but recent report through last October through this June, Doug, between 30 and 50,000 Americans died of COVID between last fall and this past June, which was an alarming number. And, this is the number of people that die every year. Flu also, around 30 to 40,000 Americans die of influenza every year. And that's why we, again, strongly recommend people get their vaccinations in a timely fashion. Like I said, our health departments do have right now a limited supply of COVID vaccines. They also have flu vaccines, and eligible adults consider getting their respiratory syncytial virus vaccine. So call your healthcare provider or call your pharmacy or health department nurses and make sure they have the vaccines available, and consider getting your vaccines for the flu season. The winter season's coming upon us.
A couple of questions related to COVID. Now, since we last talked, I had a run with COVID. Back September 16th, I was actually on the air here talking with Mick Williams and Evie McNeese. And chills just came on me. I mean, it was just like I'd been shot. I mean, it just happened that quickly. I had a little bit of a scratchy throat that morning, but was not feeling bad. And then the chills came on, and they got worse, and they got worse in a hurry. And I could barely get through the 9 o'clock hour and get up to Harbin to the immediate care to get tested for whether it was flu, because I'd had the flu earlier this year. And whether it was COVID or the flu, and of course it tested positive for COVID. Fortunately, it only lasted bad for about 3 days. And then we got some Paxlovid and a bunch of other prescriptions, but we got through that. Now, what is the guideline as it relates to once you have had COVID? I think I read in that DPH release that went out earlier this week that if you've had it, you probably shouldn't get the vaccine for about 3 months.
Yes, that's correct. You should wait. And really, the reason is because your immune status is going to wane after that, and that's absolutely correct. They are recommending a 3-month interval after you've had COVID till you get the next COVID vaccine. We do know now that that this virus, as all viruses do, they change, and that's what's called an antigenic change or drift. And the current vaccine is going to be working against the current strain. Not that it would change much, but your immune status does kind of fall off after you've had a COVID infection. And while we're talking about that, it was good that you got your prescriptions right away because, it's recommended that you get a antiviral agent within the first 24, 72 hours, no later than 5 days. So you did the right thing. But if you get an infection like that, whether it's a terrible cold, of course, or you test positive for flu or COVID or other respiratory viruses, make sure you avoid anyone who may be immunocompromised, little children or the elderly. Those are the most susceptible to getting an infection. And in fact, the older you are, the more likely you maybe end up in the emergency room or hospitalization. And this is a very interesting fact that 72% of all hospitalizations for COVID last year, 72% of all hospitalizations for COVID last year were people over age 65. That's a remarkable number. And, the death rate is the highest for the very young and the very old. The people who succumb to a respiratory infection, be it flu or COVID, are the highest numbers. And second to that are children under age 6 months. So, the extremes of age are the people who become the sickest and require hospitalization and sadly may succumb to a respiratory virus. So, again, if you talk to your healthcare provider, but if you're at the extremes of age, particularly if you're an older individual, please consider getting a vaccine for COVID and flu. You only need one RSV vaccine. Just one right now is recommended. And respiratory syncytial virus is still, quite a horrendous virus to acquire. It hospitalizes people, and like all respiratory viruses, it can make you very sick, and you can succumb to it. But right now, our emergency room visits are low for COVID. They are low for flu. Very interesting fact is that our wastewater evaluation for I misspoke, but our wastewater for COVID is high, but for flu and RSV, it's low. It's very interesting. Our wastewater testing is high for COVID, but fortunately right now it's not manifesting in a lot of emergency room visits or hospitalizations, which is a very interesting fact. So we do have some COVID in the wastewater that's being tested, but right now we're not seeing a lot of emergency room visits or hospitalizations from it. Be that as it may, we don't want to see a lot of emergency room visits or hospitalizations. So we are still recommending vaccines for COVID, flu, and one for RSV.
Now, does it make a difference, Gary, back in the day, in 2021, whatever it was, and I don't have I still have my my vaccine sheet document. I did the first 2 shots back when they first became available. I did the first 2 shots. I did it with Moderna vaccines. Does it make a difference at this point whether you stay with the same provider as you did before?
That's a great question. No, it doesn't. There's information now that if you've had maybe some sort of reaction to one of the vaccines, you can certainly switch. There are 3 vaccines available, and so you have a choice of which one you would like to have. 2 of them are mRNA vaccines, and the other one is a cellular type of vaccine that is produced where a virus is replicated to make an antigen against the COVID vaccine. But you have a choice of 3 different vaccines, and we have them available at our health department, like I said, in limited quantities. But if you had a reaction to it, to your vaccine last time, you can certainly switch and change to another one. They're equally as efficacious, and the vaccine efficacy this year is pretty good. Right now, what we are seeing is that it's a 33%, which is a low number, really. 33 vaccine effectiveness of people presenting to a healthcare provider with COVID, as opposed to 40, but it is a 40% reduction in hospitalizations for people who have been vaccinated. And that's a huge number when you consider a 40% reduction in hospitalizations from a respiratory virus, particularly COVID. That's a huge number that is we're seeing. So again, if you had a reaction to one of the vaccines last time, you can change, and the alternative is it will be just as good.
What about the flu, Gary? Do we know yet which variety of flu is most likely to be?
Yes, they have that available now, and they do have vaccinations against the current flu vaccine, and that's because what we saw in the Southern Hemisphere flu season. There's very interesting data that we just got that in the Southern Hemisphere flu season, which precedes ours, the seasonal flu vaccine in the Southern Hemisphere, at least, reduced outpatient visits by 50% and hospitalizations by 50% in the data from the Southern Hemisphere flu season. This is, of course, the countries south of us and South American countries primarily, but their flu season was significantly reduced in its disease sickness by 50% in healthcare associated visits needing intervention by a physician or a healthcare provider, and reduced the hospitalization by 50% in data just out this past week from the Southern Hemisphere. That's remarkable. That's a remarkable reduction in disease and in vaccine efficacy.
And hospitalizations as well. That's tremendous. Well, Gary, we appreciate you being with us this morning. And,
okay, Doug, I'm glad I could talk to you. Thanks for letting me spread the word. And when you see your health department nurse, thank her for all the hard work they do for us in the community.
Amen to that, my friend. Gary, thank you so much. We appreciate you.
Thank you, Doug.